So again, welcome. Good morning, afternoon, evening, whatever time zone you're in. We're grateful to have this hour together with you. This is part of a series of Matthew 25 workshops, and today is specifically on end poverty, measuring our impact holistically. And so this is a way we're talking about how do we know how to assess the work we're doing. We do want to ground in faith. A group of denominational and mid-council leaders have come up with some faith assertions about poverty. And so ask you to join your hearts and minds as we read a couple of these, and these are available on the Matthew 25 website, which we'll show later how to get to that. But our first faith assertion: we repent that Christians have misunderstood or been misled by biblical passage taken out of context or by theological interpretations that distort the gospel's original intention. We repent that the church has used scripture to uphold systems that perpetuate oppression and poverty. We do not believe that the poor will always be with us indicates poverty is inevitable or God's will. We do not believe that blessed are the poor in spirit indicates it is a blessing to lack economic sufficiency or basic human rights. We do not believe in a prosperity gospel where God blesses faithful people with economic riches or condemns unfaithful people to poverty.
We believe Jesus Christ models how we are to live in community and to confront systems of injustice, including poverty. Jesus Christ taught us to care for the vulnerable, to be a good neighbor, and to provide food for the hungry. Christ proclaims good news to the poor. Jesus Christ came not to condemn the world, but to save it.
We declare that poverty is not a personal problem, but a corporate sin, and that a church that is indifferent to poverty or evades responsibility in economic affairs or is open to one social class only offers no acceptable worship to God. Enslaving poverty in a world of abundance is an intolerable violation of God's good creation.
We had a gathering last month where we really delved into what is systemic about systemic poverty. So I'll refer you to that for more in depth, which isn't the primary focus of today. But just to touch on it a little bit, systemic poverty refers to the economic exploitation of people who are poor through laws, policies, practices, and systems that perpetuate their impoverished status. We live in a world where not all have equal access to things like education, transportation, fresh food, financial resources, to clean air, water, healthy environments, or to employment with a living wage, or healthcare benefits, citizenship, and affordable housing. This lack of access then creates generational cycles of poverty and a racial wealth gap. And those are systemic in nature. An individual cannot change their economic and social location easily by just working harder. Meanwhile, the many interlocking disadvantages often are compounded by choices to stay near family or a particular location or employment opportunity, or by gender and racial injustice, by trauma or violence, immigration status, climate change, environmental degradation. So we want to ground that we're working on eradicating systemic poverty. So as we delve into this measuring our impact question, wherever we're doing our work to eradicate systemic poverty, whether that's in our worship life, our learning and Christian education, our relationships, our action and advocacy, our sharing of resources, in all of those ways, as we work to eradicate systemic poverty, we have these core principles. You'll see the URL there that a team has come up with to commit to be present with, listen to, and be led by those who live in impacted communities, to seek equity and diversity in leadership, and to learn about system structure and practices that perpetuate poverty. So with all that in mind, as we ground and open our hearts and minds to God and one another, I'll turn it over to my colleague, Andrew, and great thanks for his introducing this model of how to measure impact holistically.
Hello, friends. Andrew Conn Bartlett. I work as the National Associate for the Presbyterian Hunger Program. And yeah, we'll just jump into the presentation as soon as I can pull this up high enough to hit the slide screen. All right. Hopefully you can see that. Thumbs up.
It's on that presentation mode.
All right. Let's swap screens. There we go. Better?
Yes.
Okay. Actually, let me just do what I did a minute ago and just swap screens again and move this to, yeah, it'll just take 1 second. Just gotta pick desktop 2. There we go. Does that look good? Okay. Thanks for bearing with me. So yeah, how do we know we're making progress on systemic poverty? So I'll be presenting a tool that I think will be very helpful in that, so that when we are supporting groups, when we were doing our own work in communities, in our areas, that we can know if we're being effective, figure out where we might want to make shifts and change things, and yeah, just have some real practical tools for measuring our progress. So ending poverty, Rebecca gave a great intro on what it is we're looking at. Again, just practices and policies on the positively stated that increase agency, equity, and prosperity of oppressed people, and figuring out the economies that are oriented around people and wellness, not profit and extraction. And so we have to know what our vision is, right? A vision in this case, which focuses on whole communities. So looking at community and societal health, one in which where all can thrive. And what's key here is to not come in with a set definition of whose vision, of our vision of what it needs to look like, but to really be exploring with folks who are directly impacted in the communities that we're working with. So just by way of introducing that, looking at one of our amazing partners up in Chicago, Little Village Environmental Justice Organization, here are just some of the indicators of poverty in their context that are a reality and they are working to address. So low income and wealth levels, lacking access to good education and training, unequal medical treatment, medical care, and poor health outcomes, high unemployment rate, a lack of access to affordable housing, and limited access to affordable, healthy food. So just to reemphasize all of these contexts will be different, and it's important to look at the problems, solutions, strategies, and vision, which will depend on one's social placement. So make sure the people experiencing poverty and struggling against it are at the table, shaping every step of the way. But I think there are some big things we can say about approaching poverty, systemic poverty, that are just broad and kind of general, like increasing the wealth of economically marginalized people and groups to address both individual and systemic poverty. Within that, of course, are groups who are especially marginalized, oppressed, and so on. To increase the representation, agency, power, and wealth of those most impacted, and to increase equitable access to opportunities, capital, institutional support, healthcare, education, training, good food, transportation, and housing, and there may be others. And so as we think about how do we do this in new ways that don't replicate the somewhat paternalistic or colonial ways we may have approached community improvement development in the past, what does a more decolonized approach look like? So less on the idea of fixing a problem with that kind of narrow view and more on holistic values-based outcomes, not so much emphasis on quantitative objectives, but making sure that there are qualitative change outcomes also. Less of a scarcity mindset and really looking at the assets that are existing already within the people and the communities we're working with. And a long-term commitment, not the one and done, but really making the commitment over the long haul. So how do you measure those things? Let's, how do we evaluate, define, discuss, and measure the success of our work as we take this approach? And I guess in summary, yeah, just another slide which kind of outlines this in broad strokes. Eradicating systemic poverty. To do that, we address systems holistically as we work to build the beloved economy that works for all. And to make sure that it is an approach which is grassroots, bottom-up, people-centered. So yeah, whole measures. It comes from, this particular model was adapted from the Community Food Security Coalition's Whole Measures for Community Food Systems. Whew, lots of words. But basically, it comes out of the Center for Whole Communities, and it is really a proactive approach to looking at both planning and monitoring and evaluating how you're doing on your work to build whole communities. So understanding the systems that create poverty requires asking questions about what is truly valued. What kind of community do we want to live and work in? How are we and our organizations helping to build and sustain those healthy and whole communities? And in what ways are institutions and systems working against those values? So finding whole measures that give substance to the outputs and outcomes require exploring and creating a more detailed story about the values reflected in our work, and to track the impacts, both positive and negative, of our efforts. So we have these two tools. The one on the left is what came out of our work to build this whole measures for community food systems. And in this booklet, which is a free download, which you have the links to, I believe, and we can supply that in an email following this, are detailed descriptions on the process, how you do this. But we'll touch on a few of those just so you feel comfortable to kind of dive in and potentially start to use these things. On the right is a worksheet, which I kind of geeked out on. Originally, it was a shorter thing that we used with the community food systems, looking specifically at food systems. But this one you'll see, deals more broadly with poverty as a whole. So within the overall view, we have these lists of 5 areas. We're calling them practices, so five fields of practice. There was one in the original, which you'll see in the booklet, about vibrant farms, but we've narrowed it down to these 5: justice and fairness, strong communities, healthy people, sustainable ecosystems, and thriving local economies. And just to touch on briefly the ways that whole measures can be used, the simple methodology is to, in your group, whatever that looks like, form an evaluation team. Or if you're just getting started or at the front end of some initiative, form a planning and evaluation team. Understand the rubrics, which I'll talk about briefly. Define the intended outcomes. so that is truly contextual to your community, your area of work. And then there's a process of people putting in their individual ratings for the different practices, and which we'll look at in a second. And then the important piece of then with community members, with everyone that's participating, to have dialogue about what those numbers tell us. Are we making progress in one area, falling behind in others? What do we do to address that? So that's where you make adjustments, shift things, strengthen things that are working well, etc. And as I said, yes, you can use it as in the early stage of work, when you're first defining outcomes, midway to monitor how things are going, and later to evaluate and make changes. As I said, you could also incorporate these same values-based measures into an existing initiative. So yeah, just to get you familiar with the terminology very quickly, we're calling the general themes fields. And then these in blue are the practices, kind of high-level objectives within each field. And then under each of those fields, you would have more specific outcomes to give focus to your work. And then the rubrics is just the scoring methodology, and it's small here, but blowing up that scoring grid, you've got a place where people can say, wow, we wanted to build more affordable housing, but because we lost the mayor's support, we've actually seen a negative impact. Or you've made great progress in providing childcare across the community. So yeah, high impact, and people would go through and individually rate those. And then there would be a discussion based on where people came out on that. Very participatory, fully inclusive process. So before that review slide, we will jump into the worksheet itself so you can see how that works. So yeah, it's a Excel sheet. If you know Excel, it'll be easy. If you don't know Excel, it'll still be easy, because you can go in and say, well, we're really interested in affordable housing. We're not addressing these other things. So you just click on that, you right click and say delete. And it goes away, and you can tailor your worksheet to exactly the kind of work that your community is prioritizing. So you might end up with something more manageable. Yeah, this first sheet tries to be comprehensive, so it gives you possible ideas for many of the outcomes.
If I could just stop you briefly, we're seeing a beautiful picture of a mountain with the sunset behind it.
Yeah, let's see if we...
Carl thinks it's Yosemite, is he correct?
Yeah, that's...
Okay. Okay, now, yep, we're seeing it now, thank you.
My bad, yes, great, thank you very much for interrupting. Okay, let me move stuff out of my way. Okay, so yeah, you didn't see me delete, so yeah, you don't want to work on food, your focus is really housing, at least this year. So you just delete the lines that don't work, and you can really customize this worksheet so it fits what your community, what your initiative is focusing on. And so after kind of going through the different areas, strong communities, lots of possibilities, this is trying to be comprehensive so it has more than you need, and you can just remove and change things as you wish. But then you might end up with, something more manageable. And this one, for example, focuses, I just made kind of a sample one, which focuses much more on kind of the equity aspects of community improvement. And so there might be lots of things about strong communities, improving equity in response to community needs, with a number of outcomes below. You're looking to foster healthy people, and so you've kept these two main practices and have these outcomes that you're going to be evaluating later, either midstream during the project, hopefully, or perhaps also at the end when you're finishing up a certain period. You decide, yeah, there's only one of the ecosystem species that makes sense for what you're working on. And that's the practice and the outcome that you decide to focus on, etc. You're working on affordable housing, say, so you also want to push back against the forces that are removing affordable housing from your community. So you decide you keep one, and here are the outcomes that you want to focus on. So that's basically how this works. And you would just check off here, and each person would go through and kind of in a group process check off, and then create that space for a rich kind of participatory evaluation at the end. So let me just jump right back to the kind of summary, and I think that'll work if I hit slides again. You seeing that? So yeah, just up top, you've got your 6 steps and how you actually put this to use. And you've got the worksheet with those 5 fields of practices and a customizable worksheet to make that work for you all. And you've got those in the chat, so you can go into those and download them. And those are just some short links to them. But I will stop there because there may be questions, and I want to make sure to leave time for everyone. And excellent. I think I'm under my time. Thanks. Stop share. And I will pass it back, I guess, to Rebecca to move us to the next speaker.
I think Margaret Mwale from the Presbyterian Ministry on the self-development of people. You can correct the way I said that. I think I maybe didn't say it exactly right, but Margaret has some things to share, kind of giving an example of one of the SDOP organizations.
Thank you, Rebecca. Hello, everyone. It's great to see all of you. My name is Margaret Mwale, and I am with the Presbyterian Committee on the Self-Development of People. So yeah, really grateful for this opportunity to respond to Andrew's excellent presentation. Thank you, Andrew. So what we're going to take a look at now is how do we actually do this work that was just laid out for us? How do we actually measure holistic impact? And so what we would like to share with you is a group which is called the New York State Youth Leadership Council. So this is a group that is still to this day working on different issues related to being undocumented. But I want to take us back to something that Andrew shared. So these are the practices that were laid out for us, or the fields, the areas of practice: justice and fairness, strong communities, healthy people, sustainable ecosystems, and thriving local economy. And what I would invite you all to do is to keep in mind that as we go over the few slides that I have for you, that these are the things, as we're seeking to measure holistic impact, that we want to be making sure that we are referencing. So let me move us right along. So the New York State Youth Leadership Council is a group that has been around for several years, but they are undocumented for youth. And so they've been seeking to acquire for themselves and to help other undocumented youth that are in their community to obtain the tools and the space that they need to organize and to create change in their economic status by moving out of poverty. So in this case, we are going to be looking at how these different fields or areas of practice, as you can see on this slide, justice and fairness, how they move through these different stages and help us to see how we can practically measure what Andrew was speaking about a few minutes ago. So the youth have been impacted by systemic poverty due to US immigration policies, which limits their access to higher education, employment options, and their ability to earn a living wage, and thus contributes to keeping them stuck in poverty. And so their goal, very important, we want to know what is the goal of whoever we're partnering with, is specifically to move out of poverty through improving their access to higher education for themselves and other undocumented youth. And they are doing so using the tools that you see on the other side of the slide, i.e. community organizing, leadership development, access to higher education, community building, self-expression, and healing justice. And we will in particular be focusing on the tool that is connected to access to higher education and how they are trying to acquire that through some of these other methods. So when you look at the next slide, starting in the mid-2000s, they started to look at how could they build strong communities, and they themselves be part of that strong community, but also rally others to their cause. So as you can see on the side of your screen, there's that beautiful picture with Pass the Dream Act. And so what happened was immigrant rights organizations in New York convened to discuss organizing strategies to support the Federal Dream Act. The Dream Act would permanently protect certain immigrants who came to the US as children, but are vulnerable to deportation. And this is exactly who this young adult, this youth-led group that we're talking about, that is who they are. And so the youth then started to build capacity in order to form these strong communities and to strengthen their group and community by rallying others to their cause, thus involving a broad range of community partners, including educators in schools and colleges. When you think about it, it's really pretty phenomenal. It's amazing that they've been able to do this, but they continue to this day doing this kind of work. So the youth then created their own organization, i.e. the New York State Youth Leadership Council, which is the group that we're presenting to you. And then in 2012, Deferred Action for Childhood Arrivals, i.e. DACA, passes. And DACA offered protection from deportation. It also offered work authorization and advanced parole to eligible youth. So they continue to form these strong communities. Again, that's very much one of those areas that was mentioned in the presentation we have just been listening to. So healthy people is another component. And depending on the context, this will look different. These are youth that are working on immigrant-led issues, in this case, trying to get out of their situation of poverty through the different things that I've just talked about. And so there is a definite intersectionality between the New York State Youth Leadership Council members' lack of access to higher education, as this impacts their ability to have food security, to have healthcare, really, and so to be healthy, and also to find employment that pays a living wage. And all of these things contribute to keeping them in poverty. So as they seek to become more healthy, initially, the YLC members, that's a mouthful, but they faced inequities such as lack of resources for undocumented students and a lack of organizing and advocacy skills. So what they started to do was to begin to work on building up their organizing, advocacy, and leadership skills. And so these undocumented youth at the New York State Youth Leadership Council actually wrote and presented the New York State Dream Act to the New York State Assembly. So obviously there were other people in the community that were part of these efforts, but remember when we were talking about making their communities stronger, which they themselves are proud of, through those efforts, they were able to actually get to this point in collaboration with others in their community. So healthy people, let's continue with that for a little bit more. So one of the other things that they wanted to do was in becoming more healthy, and think of that from a holistic standpoint, not just healthy in terms of, like the way we think of being healthy, like eating well and being healthy that way, but think of it holistically. So they wanted to build up their skills, such as self-advocacy, community organizing, and analyzing systems of oppression. And so these are part of their seeking to develop the leadership skills. Also, Undocu Academy is something that they have formed, again, in their efforts to become more holistically healthy through the Undocu Academy, which offers mentorship, college access workshops, application assistance, and professional development. So those youth that are a bit older than the others have been able to offer this mentoring to their peers. So peer-to-peer mentoring, but the ones that are a bit older are able to help out the younger ones. So thriving local economies is something else that we heard is one of the fields or areas of practice that we want to be keeping in mind as we are seeking to measure the impact of our efforts. And so 2019, the New York State DREAM Act passes, and passage of New York State DREAM Act then resulted in creation of opportunities for living wage jobs for the NYSYLC members and other undocumented or underserved students in the community, thus building up community economic literacy. So when you think about thriving, the word thriving, even the fact that they were able to build up their economic literacy, the fact that they have rallied others to their cause, this leads to a thriving local economy. And so typically, due to financial obstacles, bear in mind that only 5 to 10% of undocumented students go on to college after high school. In comparison, 70% of undocumented students supported by the New York State Youth Leadership Council's Undocu Academy, which I referenced in the previous slide, program actually enrolled in college. This has contributed to more students being able to obtain employment that provides a living wage and thus helps to move the needle on helping these young people move out of poverty, or at least moving in the right direction. On your screen, I have for you some information for those of you that might be interested in finding out more about this particular group, these youth. So their website is on there, as well as contacts. You're welcome to be in touch with any of these people. And also, if you want to go to social media, you can find them on there as well. And lastly, some of you may be wondering, what are some policies that PCUSA has with regards to immigration? And so you see on your screen something that you're welcome to reference. Thank you for your attention, and I hope that helps to give you an idea of how we can actually put into practice what we were just learning about from Andrew.
Thanks so much, Margaret. Yeah, we're just trying to expand our notion of measuring and how we can evaluate programs and not just check things off the box or numbers, as Andrew mentioned, the sort of quantitative things that we sometimes think of as measurements and moving into qualitative things. And I believe Jim McGill is going to share. He is one of our international PCUSA mission coworkers in Niger. So Jim, I'll turn it over to you.
Thanks. Yeah, I just wanted to share a little bit of experiences that we've had doing development work in Malawi, in South Sudan, and in Niger. We work with the churches. We work directly under the churches. And if you go to the mission statements of all the different churches, their mission statement includes a holistic, it's a holistic ministry to the people. So therefore, development, agriculture, health, education, everything is just as important to the church as the spiritual well-being of people. So we are involved in development, doing water and sanitation, hygiene. That's our part. The church also does the agriculture, other parts. But we do the wash part. And I'd just like to share with you how we've had to experience this issue with outputs and outcomes, how to measure development. So I'd say the biggest issue that we're working with in the church, in the holistic ministry, is trying to break cycles of poverty. So the cycle of poverty, by definition, is 3 generations of people living in poverty. And so it's a big job for the church to do. And so we have different programs in each of the departments. But the question again is, how do we measure that progress? So I just wanted to share with you this graph here. And it comes from Millennium Development Goals. And if you remember the Millennium Development Goals, it gave us 15 years to figure out how we might be able to reach a certain goal. So what they did in water and sanitation was they said that in the year 2000, that each country should take the number of people that did not have access to water and sanitation and have that number, and they should reach that number by 2015. So it gave a target, and I think Andrew talked about some of these target colonial type things in his presentation. But they gave a target, and so people, a lot of the NGOs, a lot of people we work with, put that target on 2015, say, okay, our part, we have to do 15,000 wells or 15,000 latrines by 2015. So all we have to do is go out and raise money for 1,000 latrines, 1,000 wells per year. And that's a very easy way to fundraise. You can go out and say, if you give me X amount of dollars, I'll put in a well for you. I'll send you a picture of your well, and everything will be fine. And at the end of the year, the NGO has its 1,000 wells, and everything's fine. But the problem is that they're not calculating in that we already know that 30–40% of those wells will not be functional after 2 or 3 years. And so when they look at 2015 and they realize that 30–40% might not be working, they might just add 30–40% on top of that number, so that when we hit 2015, we've hit the halfway point. But of course, the question is, what happens after the implementation is done? What happens in 2016, 2017? And in reality, in Niger has the highest fertility rate in the world, with 7.1, more than 7.1 births per female, which means that it's got a population growth of over 4%, which also means that it's doubling its population every 17 years. So what that means is, while these 15 years are going ahead, the population has doubled during that time. And so what we found out happened with this Millennium Development Goals is the goals were reached. Many of the goals were reached by 2010. But when you looked at 2015, there were more people without access to water and sanitation in 2015 than there were when they started in 2000, because of the population growth. And so, it's easy to measure those types of things, but, nothing has changed. And I would just like to go over the red line. The red line is what we did with an ecological sanitation program. So in the ecological sanitation program, you dig a couple holes about a meter deep. People use them when they're full. You cover them with soil, then plant a banana tree or plant some fruit tree, and then you watch and observe how it grows. And it's remarkable. It really is remarkable how these things grow. And so people see that and they start to buy in. They buy in little by little. And then eventually it comes up where enough people have joined in that people start looking around and say, oh, everybody else is doing this. What's wrong with me? And so they start joining in. And then the people that aren't joined in The rest of the community is looking around at them and saying, oh, you know, what's wrong with you? Why are you not there? So it was 8 years before we got 100% coverage on any of the villages that we were working in. But during those 8 years, something happened, something changed. There was an outcome that changed people so that we did not have to worry about what was going to be going on in 2016. So if you look at that graph, you look at fundraising, how are you supposed to raise money when you're getting those kinds of results for 8 years? But that's why you do the measurements and the outcome measurements like has been described in order that we can start following that how we're going to get to that tipping point that makes a difference. So in the definitions of the whole measures that Andrew presented, you have the outputs, which are the direct products of quantification of the program activities, which would be numbers of wells, numbers of latrines, numbers of people trained. Basically, the blue line would be your outputs. Your outcomes are the changes in the well-being of individuals. This is how measured whole measures defines. It says the changes in the well-being of individuals that can be attributed to a particular project, program, policy, or a program that hopes to achieve what the program hopes to achieve over time. They indicate a measurable change in participant knowledge, attitudes, and behaviors. And it defines that impact and income and outcome. Impact and outcome are used interchangeably. And so I'd like to say that the red line is the outcome part of the graph, and the blue line is the output. So these are still happening today. I got both examples are happening today. I got an email from a colleague 2 weeks ago about a project that was a 3-year project where their interventions were hand washing, drying racks, toilet construction, and increased access to safe water. So they did a baseline survey. They measured the baseline survey. They did an end of project survey. And what they published, what they presented as a measure of their success, they said that 19,925 people were served, that the percentage of respondents reporting under 5 children having diarrhea in the last week dropped from 31 to 24%, that hand washing with soap and ash increased from 73 to 96%, that homes using improved latrines increased from 11% to 99.6%, all very impressive things. And what my colleague wrote to me said, this report shows that getting stats together is worth the effort. I wish I had generated data like this for our work. Well, I disagree with him entirely, because what you're seeing with those statistics is a snapshot. It's the report card, I believe, for what the implementers of the project did. And it's not telling any of the impact that the project has had. So how do we measure that impact? And so this week I had another meeting with another group where we are looking at outcomes. And some of the questions that are being asked are people willing to invest in these changes? Who is the real owner? Is it the committee that's been set up by the implementers? Or is there people within the program that really feel ownership? What does local access look like? Can you get spare parts locally? You know, what can it be replaced locally? Also, how do these interventions impact the families economically? So there's different questions that you ask. You're looking at the outcomes. So I'd like to close just, if I can talk about Rotary Club a little bit. Rotary Club, I would say, was
Jim, I wonder if we might just pause, because I know we're about quarter to the hour and some people may have to go right at the hour. So if you might save that piece about the Rotary Club, and we could just make sure if we have some time for questions and answers, and then as part of the conversation, maybe you could jump that in there. Is that sound okay?
Yeah, that's fine. I just finish to say that we need to measure as best we can how the program has impacted people and what kind of progress is being made toward the outcomes that we're looking for that must take place, that people are able to step up on the ladder and step their way out of poverty. So, yeah, thank you.
Excellent. Thank you so much. I love how clear that is when we go for sort of a short-term result that feels good, especially to those on the outside, versus a long-term impact that really transforms lives. So that's really great. We did want to have some time for you all to ask questions of Andrew, Margaret, Jim, to share about this idea of measuring impact in ways that really focuses on the wellness and well-being of the community, not just on how many bags we pack or things we accomplish. So wonder, what questions do you have, maybe to put in the chat or to come off speaker and ask them yourself if you like.
Can we just jump in and ask the question?
Yes.
Thank you, Rebecca, and thank you all to the presenters. My question is that since all systems are composed of different components working together to determine a determined outcome, what is the greatest component of systemic poverty that, if changed, would generate the greatest impact on eliminating systemic poverty? And then how would you go about measuring that? Thank you.
Andrew, do you want to address if you can
Well,
identify?
I think I heard the question, and maybe Paula's got an answer too, or maybe another question. But yeah, I mean, for me, it seems clear that the economic system, and especially as the U.S. practices and has exported around the world, is the biggest issue here, and changes, dismantling the worst aspects of that, or getting rid of as much of that is harmful as possible would be the way to make the biggest impact. Of course, that's a huge endeavor. So I think there are ways that can take place at the more community, municipal, county level, with things like participatory budget making, getting involved in changes that will impact the economic practices that are influenceable by policy. And it seems, given, at least in the United States, that my read is that federal changes, national policies are very difficult, and certainly addressing the whole corporate system would be a big thing to bite off, but that real change can happen at the local level, and getting involved in the budget conversations that are happening every year, and with metro or county policy work can be a very effective way to begin to bring about systemic change.
Paula, will have your question, and Margaret, if you want to chime in, either a separate question or to add on to what Andrew said. But Paula, we'll take yours.
No, thank you everyone for the presentations. And no, I'm no expert on this subject, so I have nothing to add to what Andrew just said. But my heart is saddened today because I just learned of the vote against affirmative action. And I just wondered if that's something that you all may change some measurable actions or processes, but will that be something that you all will sort of try to add in your conversation around eradicating poverty? Because I can see it being a huge barrier, the action against affirmative action. And I don't have details. I just happened to hear about it on my lunch. And after my lunch, I was coming to this seminar. So I don't know if you all heard it or not. And again, it just is sad. And you spoke about something about addressing systems, structures, and yes, Andrew, that is difficult. But as the church and as these particular Matthew 25 conversations or eradicating poverty table, will that be an item that will come on the table for some serious discernment and hopefully guidance and advice on some kind of plan? Thank you.
Yes, I think there's not an immediate answer to that question, Paula, but just such an important point. And yeah, we saw that news today. And as we presented earlier, racial justice and economic justice are hand in hand. And we're dealing with systems that privilege some and disadvantage others. And I think that will certainly come to pass as part of the conversations with Office of Public Witness and our engagement in public policy advocacy. So thank you for bringing that really key point. Thank you. Margaret, want to give a chance for you to either add to the comments or ask a question.
Hi, yeah, I would like to add to the response that was given to the first question that was asked. What are some things that can be really effective in moving the needle around the issue of poverty? What are some effective things? And I think that one of the things that is really critical is remembering that at the end of the day, the people that are directly impacted by the issues, whether it's poverty or whatever it might be, whatever socioeconomic injustice it might be, their voices need to be centered. They need to have a seat at the table. And what that means is that, yes, they are, the importance of remembering that even when we partner with communities, that we need to remember that really they are the experts on some of the issues that we may be wanting to partner with them on. And that change needs to come from the bottom up. I think hopefully each of us has some sort of platform where we can bring something to the table, whether it's social capital. Maybe we are good at organizing. So how can we then partner with communities that are seeking to do that? So just looking at seeing, how can we work together and let them take the lead. And come alongside them.
If I could just add real quickly, I'm thinking about all the great work self-development of people do and hunger program support for cooperative economics. I think, on the positive side of what are alternatives to the way we're practicing our economics in our communities, I think cooperatives can be a real, or employee-owned businesses. These are ways that bring democratic processes into a business model and also provides for a more equitable, in many cases, equitable distribution of the productivity and the wealth that's being generated. So I think that's one of the tools that is used widely around the world, and there's a lot more potential for that here in the United States as well.
Thank you so much. This hour has gone by so quickly. I think there's some great things happening in the chat. I just want to point out one question, thanks to Sean Eaton, about in a small congregation, how would you prioritize among the 5 fields of practice that are suggested to be engaged in, and which would you assess? And just to point out, Andrew's answer in the chat is kind of getting a sense of where the most pressing needs are and where the energy is to push for those changes and to create alternatives. That helps you determine the framework and where your foci can be. And I am sorry that we have to kind of come to a close here. Some of us may be able to linger a little bit longer, but I want to honor our time so that you all will return and have future conversations with us and trust us to honor your time that way. I am going to ask Alicia DeMartra Presley to drop in the chat a link if you're interested in continued conversations and in a kind of cohort of folks working on these issues together. Thank you, Alicia. That this is an idea of how to stay connected after this. And I also mentioned in the chat that you're welcome to email me, and I'll try and connect you with Jim or Margaret or Andrew or others for future conversations. We will be sending out the recording and these slides afterwards. Let me just finish up a few slides to show you next opportunities coming down the pike that you might be interested in. I've got to pull it up on screen so I can share it. Here we go. So just to say that in terms of this series of webinars, we're basing this off of one of the Matthew 25 foci, which is eradicating systemic poverty. That short URL you see there is how to reach lots of resources and FAQ to learn more about systemic poverty. We only used 3 of 7 faith assertions, so you could get those there. Some core principles and assessment questions as you go into work determining what your focus might be, as well as resources that PCUSA provides to help you in any different area you might engage in your worship life, your education, relationships, actions, or sharing. And there are a couple other opportunities this year to engage specifically on eradicating systemic poverty. In 2 months, there will be one that is very specific to the ways that we really can organize at a deeper level for systemic change, and those are community organizing, movement building, and public policy advocacy. So we're delighted that we should have Reverend Liz Theo Harris of Poor People's Campaign with us, as well as Reverend Dr. Jimmy Hawkins from our Office of Public Witness, as well as a congregation-based community organization in Richmond, Virginia, Denzel Mitchell. So that URL, pcsa.info/community, is a way you could go ahead and register, but we'll send this out by email to all of you registered afterwards so you can have the direct link, and I'll drop it in the chat once I stop sharing. You can't put the www in front of it or it won't work. You just have to type those pcsa.info/community into the browser. We do plan to have a webinar at the end of October, also taking it to a bit more of an international focus. So just wanted to let you know that those are coming down the pike, as well as there will be a Building Congregational Vitality webinar in August. We will advertise once we have a firm date for dismantling structural racism. And January of 2024, there will be an in-person opportunity to gather together in Atlanta. So just wanted to let you know about those. And thank you again for joining, for all of your efforts, your care, your passion, your prayers that go into eradicating systemic poverty. So we will draw this to an official close and stop our recording. I am available to stay on a couple more minutes if maybe Andrew, Margaret, and Jim can, if there's a follow-up question or two.